today. Her name is Alexandra Flaxmann, and she's with CareDx, and she's a patient marketing, advocacy, and engagement and public speaker and writer and patient advocate. She's a two-time kidney transplant recipient as well, so she plays a vital role in what this is all about. So, Alexandria, would you take the stage here and tell us all about what we really should need to know and actually talk about with to our transplant centers where we're going regarding the cell-free DNA testing? Thank you.
Thank you so much, Bobby. I'm happy to be here. Before we dive into what I'm going to talk about, we're actually going to watch a short video that is made for patients to better understand how donor-derived cell-free DNA works. And since I know we have a mix of patients on here, this video is geared towards kidney, but it does work the same way for other recipients as well. So Jamie, if you could go ahead and play that.
You've probably heard of DNA, but what is cell-free DNA? Well, all of us have cells that constantly die off and are replaced. As old cells die off, they release DNA into our blood. This is called cell-free DNA. As a transplant patient, Alan's transplanted kidney also releases DNA. This is called donor-derived cell-free DNA. While it's normal for Alan to have some donor-derived cell-free DNA in his blood, too much can indicate that there may be an issue with his new kidney. The Allosure blood test measures the amount of donor-derived cell-free DNA in Alan's blood. Allosure may increase a median of 3 months before clinical signs of injury appear, allowing Alan's doctor to take action. And when Allosure levels are low and stable, Alan can have peace of mind knowing his kidney health is under control. Ask your doctor about Allosure today. Learn about Allosure and access resources for transplant patients at caredx.com.
Thanks, Jamie. So I'm just going to talk a little bit more specifically about donor-derived cell-free DNA, and then I'll share a little bit of my personal experience. So I know we all are very used to getting our transplant labs done. We know what our values mean. We know when we need to be concerned and when we need to have questions. My expertise is obviously in kidney. I actually just recently became a 3-time kidney transplant recipient. I need to update my profile. I had my 3rd transplant in August from a living donor, and I'm doing really well. But this is kind of going to get into personal and also explaining donor-derived cell-free DNA. I would not have made it to my 3rd transplant if not for Allosure. And the reason is again, we all have our regular transplant labs that we get done. I have always had a creatinine that ran high. So my creatinine, even after transplant, immediately when I had my 2nd transplant almost 12 years ago, it was 1.2. It was never below 1, and that was just normal for me. And then after a period of time, it started creeping up to be a little higher. But again, it was just always normal for me. I had transitioned my care to another transplant center, and they were, getting used to me, and they saw that my creatinine was high, and they immediately wanted to do a biopsy. And I was like, I have really bad experience with biopsies. I really don't want to do that. I knew about CareDx at the time. This was before I worked for them. And I was like, hey, can we try this instead? And they said no. So I ended up going to a different transplant center and advocating for myself to find someone that would do the Allosure test first. And originally it came back and it was fine, showing that like the biopsy would have been a waste of time. Fast forward a little bit, going back in for my routine checkup, instead of doing a biopsy, they decided to do an Allosure again. And even though my creatinine was still normal for me, my Allosure was very elevated. Which led them to then do a biopsy to kind of figure out what it was exactly. And it did show that I was experiencing antibody-mediated rejection. But because of the Allosure giving them that early warning, again, they were able to change my treatment plan, put me on some different immunosuppression medication, start me on a few infusions. And this was back in 2020, literally like weeks before COVID broke out. And it truly allowed that kidney to hang in there for another almost 4 years in order for me to get my next transplant. And I was able to do a preemptive transplant and avoid going back on dialysis because of that early indication. I know that with both biopsy for kidney, heart caths for heart recipients, bronchs for lung transplant recipients, it's very invasive. It can cause a lot of anxiety. It comes with complications. It comes with being in the hospital. And then again, depending on your experience in the past, you might have to be fully sedated. Like I have to be fully sedated just because of the past trauma. You have to take a whole day off of work because you got to rest afterwards. And, you know, it's a lot of time. Whereas Allosure is just another simple blood test that is done either with the rest of your labs or on a different cadence if you're, you know, not doing your normal labs as often as you would. And it does start to show that something might be wrong 3 months earlier than your other labs would show. Again, it doesn't necessarily mean that you can reverse any of the damage that could possibly have been done, but you might be able to slow the progression, get in there and change some of your regimen and help kind of keep you stable a little longer than you might if you waited for your creatinine to be elevated or your labs for if you're a heart recipient or a lung transplant recipient. And again, you know, I don't like biopsies at all, but I know that for heart recipients and lung transplant recipients, it's so much more invasive. And this is just a really great, not necessarily an alternative, but an added test that you can use to better decide if a biopsy is necessary. At CareDx, it is available for kidney, lung, and heart transplant recipients. And then we actually just recently launched for Allosure Heart in pediatric patients, which is huge because, you know, with kids, it's so much harder for them. And I do see a question in the chat, which I'm going to get to. Excuse me. But it is available for those organs. In heart transplant specifically, it's actually already used in over 90% of transplant centers. So if you are a heart recipient, especially a newer heart recipient, chances are that you may at some point have already gotten either an Allosure or an AlloMap, which is gene expression profiling and a little bit different than Allosure. It's been around for a little over 20 years for heart transplant recipients. We have been around for almost 9 years in kidney, and then this year for lung will be 3 years. And again, as I mentioned, we just like a week ago launched for Allosure Heart in peds. It is covered by Medicare. As long as it's, you know, appropriately coded and put in correctly by your doctor. And then it is covered by many private payers. But the other amazing thing is that CareDx does offer a financial assistance program so that if you do have any issues, we have a dedicated line, a dedicated team that can help sort that out with your insurance. And even if for whatever reason your insurance did get denied, we would never withhold the results of your test. So you would still find out, your doctor would still find out what your score is and be able to treat you no matter what. I think that covered the insurance question. I could go on and on, but I think it's helpful to, you know, answer any specific questions that anybody might have. So Bobby, I don't know if we want to just allow for some questions, or do you have a question you want me to talk about?
Yeah, I do have a question. In general, for the entire population here listening, if you know you've had more than one transplant, is Allosure will it work? The reason I'm asking that is through personal experience. I was told, you know, my son was told that, you know, they couldn't do that because of the amount of genetics involved, like from, previously that it wouldn't give accurate results. Is that true?
So it really depends on your physician and how your transplant center feels about it. I know you and I talked about this previously, so just in the interest of full transparency, when I was on my second transplant, my transplant nephrologist at the time had led the clinical trials for Allosure in kidney patients, so he was very confident with understanding the results, reading them, and making sure that they were accurate. So he felt comfortable using it for me. I know other patients who are on their second, third transplant and their provider has used the test. It really depends on the confidence of the physician that is ordering it. I do know, especially, there's quite a few patients out there who will have dual organ transplants, like heart kidney, liver kidney, things like that. They usually won't order it for those because not only is it a multiple transplant, but it can just kind of create a little bit of confusion. I think I answered that question before you could ask it, Sam. So it really just depends on the confidence of the team. The other thing that is really nice about this, and I think one of the speakers was just talking about the transition period, especially for kidney recipients who might be moving from their transplant center back to their community nephrologist. Community nephrologists can sometimes, feel nervous taking care of a transplant recipient and managing their care because they are community nephrologists. They went into that for a reason. And with Allosure, it can kind of help them feel a little more confident that they are managing their patient. And instead of picking up the phone and calling the transplant center every time something happens, being like, I don't know what to do, they can kind of rely on that tool to better guide how often they need to call the transplant center and get them involved.
I have a question, a follow-up on that as well. Whenever Allosure testing is recommended to be done, is it true that you have to do it like pretty quickly after your transplant in order to establish a baseline to go from, or can it be done really at any time to look at the results? And this would be, so the reason I'm bringing it up is so that people know that when they're meeting with their physicians early on at their particular transplant center, to bring up these questions and ask them about that in order to get it, like, so to speak, pre-authorized or whatever. But could you elaborate on that a minute?
Yeah, I don't want to get like too technical, but essentially, yes, for the standard use of Allosure, there is a protocol. So within the first year of transplant, you would get tested months 1, 2, 3, and 4. And then you would get tested again at month 6, and then you would get tested again at months 9 and 12, and then quarterly thereafter. And the reason that it is important for most patients to establish that baseline is, again, using me as an example, if my creatinine is all over the place, and that's not a good indicator for me to know that something's wrong, it is helpful to have that baseline of Allosure because maybe your Allosure also runs high. So if your Allosure comes back at 0.7, but that's what your Allosure has always been, it might not immediately be an indicator that something is wrong. However, like I mentioned, I had my first Allosure on my second transplant when I was just over 7 years out. And because I was that far out and we were potentially concerned about issues, my team did feel confident using it, and it came back so elevated that there was no way that it was like a false positive. So the baseline wasn't necessarily necessary at the time. Allosure can be used both for surveillance and for cause, meaning that something else has happened that is telling your doctor something might be wrong. And again, it's another tool in your toolbox to use to kind of help dictate what the next step is and to kind of help. Again, it does not replace biopsy because Allosure will not tell you what is wrong. It'll just tell you like, hey, something's not right. I like to use the example of a house, like a fire alarm. If your fire alarm goes off, it's telling you like, hey, there's smoke, there's something happening. And if you get that early detection, then maybe you just like lose the kitchen, but the rest of the house is fine. Whereas if you were to wait for maybe your creatinine to elevate, you might lose the whole house and there's no time to try and salvage anything. But at the end of the day, if your Allosure does come back elevated or your AlloMap comes back elevated, your team is probably going to have to do some kind of other testing like a biopsy to figure out exactly what it is. You know, the other physicians have mentioned, you know, there's different types of rejection. There's different things that cause rejection. Allosure said something wrong. Biopsy told them it's antibody mediated rejection. So it's more to influence what's next and maybe help